Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and today's episode is about a common question we get often, which is eyelids and eyebrows, essentially upper eye rejuvenation. We get a ton of questions regarding this. I made a few posts and I got even more questions about it, so we decided to dedicate an entire podcast to this subject. So essentially what we're talking about is many patients notice, usually around their late 30s, early 40s, that their upper eyelid area just starts looking closed. Most commonly in women, they start to notice it when they put on makeup. They get smudging of their makeup, they can't put eyeliner and mascara and things of that nature. So let's discuss first, by far the most important thing, anatomy. What is going on? Who does it happen in and why? So like every part of our body, with age, it tends to sag. It doesn't matter if it's your neck, your breast, your belly, all things with time, both gravity and due to elasticity and change in the quality of your skin starts to sag. So your eyebrows and your eyelids are no different. Now, what happens is you go live your life, you're living your life, everything is great, you're gorgeous, you're young, you look wonderful, and then sometime in usually around your late 30s, you start to look in the mirror or look in a photo and be like, wait, my eyes are looking a little beady. My eyes look a little heavy. God, what happened to the space between my eyelashes and my eyebrow? And that's the first thing you start to notice. And what ends up happening is then the first guttural response is, God, I have excess eyelid skin. And so the most common first request for patients is, I think I'm developing excess eyelid skin. I need an upper blepharoplasty or an upper eyelid lift or removal of that excess eyelid skin. Now, where this becomes interesting is that seldom do people in their late 30s and early 40s develop so much eyelid skin that it's the only and main cause of the issue. What do I mean by that? What happens is that often, not always, but often, in addition to the eyelid skin becoming a little lax or a little redundant, there is a slow and gradual settling or lowering of the eyebrow. In other words, the eyebrow starts to come down a little bit and the eyelid creates a little skin, and together they create this sort of heavy look to the eye in general. The reason I mention that is because when patients come in and I examine them and then they ask me what their options are, the first thing I do is I have them hold a mirror. And then I will, without doing anything to their eyelid, I will gradually raise their eyebrow in front of the mirror and I'll say, what do you think of that? And 9.5 out of 10 patients are like, whoa, wow, that looks so much better. Mind you, we haven't even touched their eyelid yet. So why this podcast is important is we're talking about the relationship between eyebrows and eyelids. And 99% of the times where I do an upper, 99 is aggressive, probably 90% of the times or 80% of times that I do upper eyelid surgery, I also do something to the brows because, as I mentioned, they're seldom in isolation. So let's talk about the brows. Now, brows they're long. They start between the nose and go all the way to the outside. So the outer portion or the outer third of the eyebrow we call the tail of the eyebrow. And that's the part that usually has a little arch to it. In terms of aesthetics, we like aesthetically for the outer third to be kind of lifted. That's where this whole Botox brow lift thing came about. In other words, we want that arched brow. Obviously, we don't want you to look like some crazy spooked person, but we do like an outer brow that's elevated, lifted. And so what happens is that when you start to sag on the outer third, that's normally where you start to sag. You don't generally sag in the middle 2/3. Very, very rare that the middle 2/3, the stuff in the middle, has come down. That's usually something that occurs in your 60s and 70s. Almost always, the first thing that happens is the outer third starts to settle and you get what's called hooding. That's right, the famous term hooding. Now, some people are born ethnically with heavy brows, meaning it's thick and full, and it's a beautiful version, but they already start out with a thicker brow, meaning more fullness. So as soon as they get older, that relaxation leads to more hooding. and they feel a little bit of fullness on the outer aspect of their eye. That is not eyelid skin. That is eyebrow. So in order for that to look good, we need to raise the outer third. So the most common type of brow lift that I do is a limited or lateral brow lift. That means all I'm doing is lifting the last third of the brow to relift that area on the outside where the crow's feet is and make it look a little more open. It's a very simple, very straightforward procedure. You have a small incision in the hairline, back inside the hair, and from there we just lift the brow. Now, when you do that, if you go in front of the mirror right now and you're over 35 and you take your finger right over your outer brow and you lift it, you'll notice that the amount of upper eyelid skin that you think you have becomes immediately less. Why? Because the excess you think is there is being contributed by the sag of your brow. That is why when I do the eyelid, I do a little bit of brow lifting, and then in addition, I remove a little bit of skin. When you do them together, you do a little of each, and both of them look natural, as opposed to a lot of one or the other. Imagine you lifted the brow so high up that you had no eyelid skin. That would look crazy. And imagine that you remove so much eyelid skin that the fact that the brow is sagged doesn't really matter. Both of those are incorrect. The recipe calls for a little pepper and a little salt, not a lot of either one. So in general, that's how we do it. Now, in addition to that lateral brow lift, there are additional brow lifts. And the brow lifts are, next one is called an endoscopic brow lift. And that differs in that instead of having a small one incision in the brow, you have small slits, and you do the lifting using sort of an endoscope, which is a camera. And then you suspend the brow that way. In addition to that, you have something called a full brow lift, and that's referring to what I was talking about when someone needs the entirety of their brow lifted. That used to be done back in the olden days. It was called coronal. Coronal means you cut all the way across the back of the hair and you pull the whole thing up. We don't really do that anymore. And now when you do a full brow lift, again, much more rarely, you do it along the hairline in the same place you would be doing a forehead reduction is in the hairline itself. So there are basically three types of brow lifts, the most common being that lateral or last third. And I do that in conjunction with the eyelid. The upper blepharoplasty is pretty straightforward and pretty routine. Everyone generally, with the exception of some Asian ethnicities, has some type of fold or crease in their eyelid, albeit short or high. There's some fold, and when we do an upper blepharoplasty, we're basically doing a little skin removal, but we do it within that crease, such that the scar falls right in that crease and then maybe extends out a little bit right in one of your crow's feet. The reason we do that is because it makes the scar incredibly well concealed. So it's very important for you to understand that rejuvenation of the upper eyelid as you start to get older tends to require both. Obviously, if you show up and you are 50, well then for sure you need your brow and eyelid done. But this is kind of to remark on the earlier people coming in wondering if it's just their eyelid. All right, so the question people ask all the time is, okay, well, how long is this thing gonna last? And the reality is that it took you 35 years, right, to get your brows to be that way. So it's gonna last a good at least 10 years, if not more. It really depends on the quality of your skin. If you got that thin, really kind of crepey type skin, you might develop a little bit of sag around 8 or 10 years. Maybe if you got thicker, high quality skin, it may be 15, 20. But one thing's for sure, it's not a 1 or 2 year kind of item. Now, one of the things, like with every surgery that we discuss, happens is people take those surgeries to an extreme. Everything I just mentioned to you is mild. All we're doing is resetting the way your eyelid and your eyebrow look together to kind of where you were when you were 17, 18, 20. You can, and it is being done, be very aggressive, and when you pull the brow and the eyelid corner up high, you get sort of this cat-like effect, and it's quite common now on social media with people like Bella Hadid or whatnot. And what you're doing essentially is not only are you lifting the brow, not only are you removing eyelid skin, but you are changing the position of the outer corner of the eye. That's right. You are lifting the corner of the eye as well, hence creating a more cat-like or slanted look, and that changes dramatically the way you look. The procedure I spoke about originally, that is not happening. And the procedure I'm speaking about now, when you are very aggressive with it, you can start to change the shape of the eye. I, in general, am not a huge fan of that. That's up to you to decide for yourself. So, we're going to take a quick break. Then we're going to come back and then we're going to talk about the second half of this, which is what's the recovery like and what are the risks associated with this sort of brow lift eyelid combo. Let's take a quick break and we'll be right back with Plastic Surgery Uncensored. All right, welcome back to the second half of Plastic Surgery Uncensored. So we're basically just chatting exclusively, because it's a very hot topic and it's happening quite common, and I'm getting a ton of questions about it, regarding eyebrow and eyelid lifts and their relationship. So we had a full discussion about who and where and why, and now we're going to talk about the recovery. So the first thing you need to know is, just like everything, how painful is this procedure? And it turns out that generally, facial surgeries, even nose jobs, tend not to have a lot of pain. Liposuction, not so much fun. C-section, tummy tuck, also not so much fun. But facial surgery tends to not have a lot of pain. When can I go back to my job? I work at a desk, I work in an office, and we generally say 7 to 10 days. It depends on how much bruising you have. But around 7 to 10 days, maybe with a pair of glasses, you can go back to work. When can I get back on, let's say I work from home and I want to be on a computer? Really, you should be able to get back to a computer within 2 to 3 days. You may not be presentable yet, but you should be able to kind of work from home without any issue. All right, I want to be red carpet ready. I got to go to a wedding. I'm going to be on TV. I have a photo shoot. When am I going to be that ready? And that usually is about 4 to 6 weeks. That's enough time for the swelling and the redness and the bruising and all that to go away, such that nobody would have a clue at all what you look like or that you did anything. All right. So is there a lot of follow-ups? What's the care with this? We generally see patients about 4 times. We usually see them in like a 1 week and a 2 week. We'll see you around the 1 month mark, and then we like to see you back between 6 and 12 months one more time. Okay, how long is the procedure? Really, it's actually not that long. It's about an hour for the brow. Again, I'm referring to just the outer brow, the lateral limited brow lift. And it's about an hour for the blepharoplasty. So in total, it should be about 2 hours. The type of anesthesia depends on your surgeon. I tend to like to do everything under general anesthesia because I think it is the safest, because I like your airway to be secured. It's best for me because you're not moping around or making noise and moving. And I like to have a general anesthesia. But this particular procedure sometimes can be done under conscious sedation or twilight type sleep. And the reality is that it's pretty well tolerated and reasonably easy to do. All right, the last part of any procedure you talk about, and you should always talk about, is going to be the risks. What are the risks with this procedure? All too often, things are being said on social media or being advertised, and then the risk is totally being left out because it's just like, it's awesome, right? There are no problems. Sign me up. I can't wait to do it. But that's not the case, because if you go and Google upper blepharoplasty or brow lift, you're going to see, as well as all the happy people, a bunch of people that are unhappy. So what could go wrong? So bleeding, quite rare. Infection, pretty damn rare. Asymmetry. What does that mean? It means that my 2 brows are not exact. My eyelids don't match. Well, that's 100% guaranteed. The question is not whether or not my eyelids or my eyebrows match, is to what degree are they off. A slight degree of asymmetry, that's a given. You were absolutely asymmetric before, you'll be asymmetric afterwards. Severe asymmetry, that's absolutely not normal. So if you do have that, it's a serious problem. Scars. Let's talk about scars. Obviously, facial surgery is all about concealment. And what I love about facial surgery is if it's done correctly and well, nobody would have a clue. So as I stated earlier, the eyelid scar is in the eyelid crease and sometimes a little bit out in the corner near the crow's feet. And that should heal beautifully. The brow lift is in the hairline. And if it's done correctly, should also heal beautifully, such that your own hairdresser won't know where it is. That then segues me into what's called alopecia, which is balding or loss of hair. Now, It is possible that when you cut in hair, whether it's in the hair of your head or your beard, you can lose hair, but it's very rare. When that happens is when the surgeon is too traumatic with the skin, uses cautery or heat, and that causes the hair follicles to die. Otherwise, it should be pretty darn rare. And then there is such a thing as nerve damage. Now that's really rare, or at least it should be. And there's one nerve that goes across right between your eyebrow and your hair, and it comes right up, and it's the frontal branch, and it's the branch of your facial nerve. That is the nerve that allows you to raise or smile, or raise your eyebrows or smile or close your eyes. And that nerve is responsible for raising your eyebrows. Now, if you go underneath that and you damage it during the surgery, well, then you'll have an issue with your brow mobility. Again, this should be incredibly rare and avoided. So those are essentially the main risks associated with the procedure. By and large, I think it's a very effective early procedure that patients can do as they're starting to age. It's actually probably one of the earliest things that people do as they start to get out of their early 30s and into their 40s. And when done, when done well, it's beautiful procedure, eloquent, and very, very natural. At any rate, I hope you liked that very quick and to the point explanation and discussion regarding brows and eyelids. We will have a separate podcast regarding the lower eyelid. I left that out because it's its own animal, has a whole lot of other things you need to know. At any rate, I hope you enjoyed that episode. As always, if you like Plastic Surgery Uncensored, do us a favor. Go and write something nice. We love your comments. It keeps the staff and everyone motivated to keep going. And most of all, share this podcast with people you love. You never know when someone is thinking of a procedure, and then by the time you find out, they've already had a catastrophe, and then you wish you had forwarded our podcast to them. All right, that's yet another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. I'll see you guys next week.